cobalt-chromium-molybdenum alloy.
But I'm going to say Molly.
Settle down, class.
Just makes it that much more impactful for our series. This is what doctors would like to place into your body. And this is usually for the treatment of, your issues. Yeah, rather it's elderly age or due to some kind of physical activity, things went sideways, literally. And first off, we here at Standards and Spirit don't have anything against doctors. We just want to make sure that our parents, brothers, and sisters are researching as much information as possible when given because pros and cons may be delivered and will be. We understand that. Yet at the same time, is there going to be a holistic method or medicine related? Because the scientific method will be the drug of choice. Take it away, colleague.
Cobalt and tronigen are extracted and refined, maybe cast or forged, if you didn't know. Machined and tuned, precise shapes. This does not require iron or steel. Conditioning heat, well, treatment controls strength and structure for this product. So it's going to be pretty hot. Well, the finish, let's say grinding and polishing, creates smooth joint surfaces. Finished product will include hip replacement or hip resurfacing implant. This is not necessarily the deadliest metal under every possible condition because apparently even toxicity, these categories and committee members.
Corrosion resistance do not guarantee biological safety. The mechanisms wear and tear as anything. Metal particles and ions entering surrounding tissue, corrosion, all of that. Just because it talks about how strong it is, this is a moving part. Just like your joints used to be a moving part before it didn't work anymore. And you had to get that cobalt. But I would disagree to say that this is the better fix. Whenever there's a topic in relation to holistic versus almost any other criteria. The conclusion of this is pretty much you'll get that strength for the time being, temporary fix, and then the corrosion. But it is the best combination of metal manufacturing, finished product, human body placement, documented danger, and engineering failure. Now let's talk about this human body risk one more time because see, I don't think they heard me in the back.
Metal particles and ions enter surrounding tissue and blood, leading to corrosion and resistance that's not guaranteed biological safety. Well, what happens inside the body? Well, that's that metal on metal action.
Happy robot Terminator going wild.
Let's stop. All right. Let's get back to the subject.
Metal on metal hip components rub against each other during walking. We're going to need those long walks when we get up in age. I tell you, it's going to work even when you're young in age. Walking and normal movement. Over time, this can release microscopic cobalt and chromium particles or ions. So even the United States Food and Drug Administration explains the metal debris that can pretty much damage surrounding bone and soft tissue. This may produce pretty much like pain, implant loosening, device failure, and the need for revision surgery. Food and Drug Administration also tells surgeons to watch for possible systematic complications involving, here's the list.
The heart, including cardiomyopathy. The nervous system, including hearing or vision changes, cognitive or psychological things, kidney function, thyroid function, allergic or hypersensitive reactions. Moving along, Food and Drug Administration's cobalt-chromium material review also identifies spreading corrosion, excessive metal debris, metal ion release, and premature wear as documented device concerns. Just remember that. You'll be fine. Yeah. And What kind of material is it? It's cobalt-chromium.
Molybdenum.
Molly. I don't have to take that. You remember that name, you'll be like, oh no, anything with Molly in it, error, go away. Not at this age. It's an alloy. Metallic material produced by combining multiple elements with at least one being a metal. Typical elements include cobalt, right? Provides strength and wear resistance, okay? The chromium improves corrosion resistance. And say it with me now.
Molybdenum. Molly.
Improves strength and stability. It remains classified as a metal, not automatically a composite. Let's make that very clear. Alloy versus composites, y'all. Material arrangement classification cobalt, chromium,
And molybdenum.
combined into one metallic structured alloy. Metal implant combined with a separate ceramic or polymer layer. Multi-material device or composite system.
So watch what you put in your body, which most of us don't. I know I am, especially moving on up in the age. Your claim, if you were not to choose it, should be more so. Talking to myself, thinking out loud, cobalt-chromium hip implants are among the most concerning examples of manufactured metal products that can release potentially harmful metal debris and ions inside the human body. That's how accurate that is. Let me say it again. The most concerning. It's more defensible, accurate, and directly connected to the products. Thank you for your time. And as you already know, go ahead and hit that like and subscribe to your boy.